There's a lot to talk about tonight on the topic of Ontario's nurses. First, the Ontario Nurses Association met with Premier Ford today to discuss a number of issues, including the shortage of nurses in this province. Second, Canada is reintroducing the role of Chief Nursing Officer, a position that previously existed but was terminated under the Harper government.
And third, this all comes as some healthcare workers have, of course, been harassed throughout the pandemic. Ahead of a planned weekend freedom protest in the GTA, some hospitals are advising their staff to show up to work out of uniform, and it's for their safety. Here to discuss all these topics and hopefully more are Cathryn Hoy, president of the Ontario Nurses Association, Doris Grinspun, CEO of the Registered Nurses Association of Ontario, and Nikki Skillen, an ICU nurse in the GTA. Thank you all for being here. First, Cathryn, before we discuss the meeting you had with the Premier, we've been talking about how hospitals located particularly here in Toronto's downtown core have advised nurses and healthcare workers not to come to work in scrubs this weekend. As a reminder to our viewers, as of January the 16th in Canada, it is illegal to intimidate doctors, nurses, patients, and obstruct them from providing care or to keep someone from receiving care. So in saying that, are you concerned? And what is your message to protesters?
Well, today my focus was on the registered nurses and healthcare professionals in Ontario. And to be honest, while I was in the meeting with the Premier, that's when all this was unraveling.
Nikki, as an ICU nurse, are you concerned?
I'm very concerned about this. I'm not. I know the Metro Police have put out a statement advising healthcare workers not to wear scrubs in the downtown Toronto area this weekend due to protesters and the possibility of harassment, if not hopefully nothing worse. I'm not sure why they would want, really, this convoy would even want to harass nurses and other healthcare professionals.
But on that
note, a little baffled.
Yeah, Nikki, we have, unfortunately, that has been the case for some throughout the pandemic. We have seen this take place, which is why there's this law that took effect on January the 16th, making it illegal to intimidate a doctor or healthcare worker. Cathryn, I want to come back to you. I know you were tied up in a meeting with the Premier, but what's your message to protesters?
So Christina, we ask for that safe zone, so let me comment on that, please. We would advise always not to use scrubs in the street simply for infection control reasons. But these people on the convoy, as you know, did all kinds of other things in Ottawa, including slur, racist speech, etc. So are we going to ask our colleagues to hide their skin? Am I going to hide that I'm Jewish? Like, what is it? Are we caving to this convoy instead of protecting healthcare workers? And also the noise is in the middle of all the hospitals. In Ottawa was unbearable, the noise. Imagine here that Queen's Park is next to all the major trauma hospitals. Just picture not only the staff, but the patients in those hospitals with the noise. It's absolutely incredible that we are allowing this to happen.
Well, you know, I mean, this is a democracy. People are allowed to protest. In saying that, you make a great point. University Avenue right here, it's also known as Hospital Row, and it's right at the tail end of that is Queen's Park. And of course, there's a reason why there are signs around the city and elsewhere where there's a hospital. You see a sign that says quiet hospital out of respect for patients and their families. Yes. Cathryn, if I could please return to you. Doris, just 1 second. I'm just going to go. Doris, 1 second. I need to go back to Cathryn for just a moment. Cathryn, I know you were in a meeting today, just to get your thoughts on all this.
Well, the protesting, I mean, the nurses have been harassed in the last 2 years through the pandemic. But they have to remember this protest is around hospitals. Our ambulances need access to the hospitals to bring critically ill patients in. And that is foremost in my mind, because nurses are already struggling to provide safe patient care as they're working at in some places a 50% decreased capacity, and now that they're going to have to deal with critical ill patients being kept waiting out on the streets because ambulances can't get through to the ERs, that's very concerning, not only for the healthcare professionals, but also for the people in our community.
Cathryn, I wanted to talk to you about your meeting with the Premier today. Was this a productive meeting, and did you get any commitments from the Premier?
We did not get a commitment. I went in with my asks, and he would not commit on Bill 124, repealing it, but he did not say no either. Now, I will say I am going to give him the benefit of the doubt because he did ask me back for a meeting early next week, and that he is to come prepared with what he would offer to healthcare professionals and nurses in Ontario. He did state himself that he understands. He acknowledges that nurses deserve more in order to be retained. So I am hopeful next week he will come to the table with something to offer. I went in with my asks. I went in prepared. So I'm hoping he has some answers for me next week.
And Cathryn, you have a firm date and time for that meeting. Can you share it with us, or do you?
No, I don't. He said early next week. He did give me his cell number, so I'm hoping it really is his cell number, because if I don't hear from him by end of business tomorrow, I'll be phoning him Monday morning and asking where my meeting is.
Okay, and we will follow up with you on that for sure.
Sorry, I just want to add, I'm not going to book meeting after meeting after meeting. His commitment to me next week was he would come prepared to the table.
Okay, Cathryn, thank you. Doris, on that note, Cathryn was talking about Bill 124, and of course, that impacts public sector workers, not just nurses. At this point, what do you, Doris, hearing what Cathryn had to say, anticipate in terms of wiggle room? Do you think the Premier will make an exception for nurses and not other public sector workers?
So let me say this. First of all, Cathryn and I are joined by the hip on this. She knows exactly what I know. And I know exactly what are the promises that the Premier has already in the table. The Premier has three options. The Premier should have offered them today. And the Premier should not continue to wait and wait and wait and wait. Repeal Bill 124 or exempt nurses and then deal with the rest. That's number one. Number two, a significant top-up per hour, anywhere between $5 to $10 per hour per nurse in all the sectors, not only hospitals and long-term care, because we have decimated home care, and you cannot do the surgeries, you cannot do anything if you don't have home care also, so you need all the sectors. Number three, that will retain nurses. So the Premier has already given in terms of increase on enrollment, so that's a good thing. Now he needs to fast-track the 20,000 internationally educated nurses that are living here in Ontario. They're here for years and years. They should be fast-tracked and be brought to the workplace. They have been waiting up to 8 years. So the recipes are there. The Premier has had this all along for over a year. He asked where they can get the numbers. So our colleagues now need action. And Cathryn is completely right. Enough of talks. And Cathryn, if it's not the cell number, I can give you the cell number. I'm sure he gave you the right number. But enough of talks. Now the Premier needs to deliver.
Yeah, I just wanted to ask you just a follow-up on another question, and really just to ask you, how short are we in terms of nurses in the province? How many do we need to meet the needs of patients right now and avoid nurse burnout?
Yeah, so we went into the pandemic with 22,000 short RNs in the province, and the Premier has the figures, and ONA uses the same figures that we have produced, so we are all on the same page. What happened during the pandemic now, just picture 2 years, right? 2 years of absolutely no holidays, no time off. People with Bill 124, where the Premier left doctors, the police, and the firefighters out. I saw the statement of the Premier. Yes, of course we want more money from the feds, but don't condition the demands that nursing is asking on the feds giving money, because he didn't condition it not for the police, not for the doctors, and not for the firefighters. So
may I add something, Doris?
Let's have Cathryn come in, yes. Or is that Nikki?
I'd like to add something to what Doris was saying. The IEN nurses is a fantastic idea. But that being said, when we have one nurse for 30 patients or one nurse for 12, the IENs need to work about 140 hours to complete their certification. It is pretty well impossible to meet your professional standards and care for 12 patients plus monitor the IEN. I spoke with the government today about developing a funded program by the provincial government to support our IENs, because in the environment we have now, it will not work. And I think there's another really important thing to remember about Bill 124. Yes, it touches the nurses and the healthcare professionals, but it does touch every single person in Ontario, because the number that Doris gave, 22,000, I believe is far higher than that, because they're leaving each and every.
Yes. Okay, I need to get to Nikki once more. Thank you both for that perspective. Nikki, as the ICU nurse here on the panel, I want to end this with you. First, if you could just share with our viewers the challenges that you've been dealing with in the last 2 years. And if I could fit this in quickly, I'm sure you're aware that there will be a Chief Nursing Officer of Canada. Again, this is a position brought back. It was removed, I will say, under the previous Harper government. What goals do you think there should be for this position, or are you concerned it'll just be a figurehead? This is the Chief Nursing Officer of Canada.
I think I actually read on the new proposed position for a chief nursing officer at the federal level. I think we definitely, nurses need to be at the table. We have been continuously left out at the federal level. We have been left out at the provincial level. We are not sitting on science tables. We are not the ones helping to make change or to advance this profession and ultimately improve healthcare in Ontario. So I do believe this is very positive. I think we need to see a little more information at this point. But what I've read so far, for me, I believe it's very positive.
And how about the challenges, you know, for people who hear about the nursing shortage, burnt out nurses? Give us the firsthand experience.
This past 2 years, honestly, I've been a nurse for 24 years in the acute care setting. My background is emerge in critical care, and I have never experienced anything like this. I worked through SARS. I am watching some very, very strong individuals not coping, crying, not returning to their shifts the next day, and some of them not returning to this profession. I'm watching my colleagues walk away every single day, and they're leaving. They're leaving for the public sector. They're working for agencies at double the amount of money I can even make on an overtime shift.
Hopefully,
and I'm a 24. Sorry.
I was going to say, hopefully the Premier's listening to that, Nikki, on that note. I would love to hear more. We actually are out of time, but we will have you back on again, Nikki. And of course, all the best to you and your colleagues. Cathryn and Doris, not been an easy time for anyone in the healthcare profession over the last 2 years. Thank you all for your service as well.
Thank you.
Thank you so much,
Thank you for having us.